Thanks everyone for having me here. I'm happy to tell you about this project that we did a few years back. It was recent. Our first paper was recently published a few months ago in the American Journal of Public Health, and I thought that this would be a good topic to talk about in the BioBasics Layman seminar because on one hand, I could tell you about things that probably matter to us in our day-to-day lives. I also thought that there were some gory details that happened during this project that might be interesting to the research administrators in the audience. And so I thought it, basically it was sort of like a perfect storm of a project. And while I'm working on some other perfect storms right now, I figured I'd tell you guys about this one. So let me just start off with a few acknowledgments because I always forget to do this. I'm going to show you some slides from Neil Kleppeis, who's a researcher up at Stanford, just because I think that they're really cool. And I also wanted to just acknowledge some of the UCLA researchers that worked on this project, including Alison Diamant, Bob Kaplan, who many of you know is now back at NIH, Chang Zhao, who was our analyst, the California Department Association that made this work possible because we really did a community partnered approach to work with them, the California Tobacco Control Program for funding this work, and the Public Research Institute for conducting the survey that I'm going to tell you about. Now, again, as Dr. Rowe mentioned to you, I do a lot of tobacco control work, so I'm not going to ask anybody here if you smoke. But I do want this to be as interactive as possible. Feel free to ask any questions at any time. The one thing I would mention is that many of you may have heard that all the UCs are planning on going smoke-free. And the plan is to do that in a couple of years. And the committee here at UCLA is getting together now. And I'm also on that committee. So if you do have any questions or concerns about tobacco use on campus, just feel free to let me know. So specifically, we all know that smoking is bad for you, but there also are secondhand smoke harms. And this is a copy of the Surgeon General report that outlined a lot of these in detail. But we know that it basically causes about 50,000 additional deaths per year, in addition to everything that smoking does. And we know that there are actually causal linkages. Some of the work has been done here at UCLA, but there's been a lot of work that, for example, has seen that there's a 25 to 30% higher risk of having a heart attack if you're exposed to secondhand smoke. You're also going to have a 20 to 30% higher risk of having lung cancer if you're exposed to secondhand smoke. Kids that are exposed are going to be more likely to have asthma or upper respiratory infections. And we also know that it's associated with low birth weight and sudden infant death syndrome. So smoke-free policies essentially protect the non-smokers from secondhand smoke. And there have been a lot of regulations and laws that have been passed to do this, and the effort's really been led here in California. So for example, with workplace restrictions in public places, and as I mentioned to you, on campuses as well. So we know that most Californians have implemented smoke-free policies in their own homes. I'm guessing that most people probably don't allow smoking in their homes. And we know that from surveys that around 75 to 80% of people have specifically no smoking in their house. And the reason why this is important is because most people spend time at home, whether you're sleeping or going home after work. Most of your time is actually spent there. We also know that smoke-free policies help smokers quit, and it sets up an environment that helps encourage smokers to quit by changing the social norm. And we know that most Californian smokers actually want to quit. Consistently, all surveys show that about 70 to 80% of smokers want to quit, and we know that they're actively trying to quit. Unfortunately, the clinical services are not as good as they should be, but that's something that we're all trying to work on. So just so you know what is the best smoke-free policy of all, this is basically getting everybody to quit smoking. And I would be remiss if I didn't let you know that there actually is a ballot initiative coming up in June that will increase the tobacco tax by $1. And that actually increases the likelihood that smokers will quit. There's a very well-known relationship that when you increase the price of cigarettes by 10%, that leads to a 4% reduction in cigarette consumption. And there's also other things that this will help do. It'll put 20% of all those dollars into tobacco control. Most of it, 75%, goes back into research. It's going to go mostly to cancer research, but basically all tobacco-related disease research. Well, I'm happy to talk about this. I know that the LA Times had a recent editorial about this. Happy to talk about it offline. In terms of multi-unit housing and secondhand smoke, we know that about 11 million Californians live in multi-unit housing, which is basically about a third of our population. And it's the second sort of largest type of home, the number one being single-family homes. Multi-unit housing units, if you lived in one of these and you set up a smoke-free policy in what you would consider your home, you can still be affected by secondhand smoke. And so that happens through shared airspaces and through ventilation, as well as drifting from the outside. So this is the stuff that I had mentioned to you from Neil Kleppeis that just demonstrates some of the work that he's done. So this is an example of an apartment building. I think this was actually in Santa Monica when he did these tests, where it's a multi-story building. These little blue spots are where they put these little monitors to detect secondhand smoke and particulates. And so Unit 405 on top is the non-smoker. Unit 305 has a smoker. Unit 205 has a smoker. And you can see, this is what they expect the air, how the air flows throughout the building. So these are measurements that they had. So for example, if you look at the parking garage, those little blue bars down there, you don't expect secondhand smoke to waft downwards to go into the parking garage. So you can see that they're pretty low levels. These red bars basically show these different areas. So outside of the smoker's apartment in Unit 305 in the hallway, you can see that those levels are pretty high. In the hallway on the second floor near Unit 205, it's much higher. And then inside the bedroom of the non-smoker, you can see that there's also these red bars up here that suggest that they're also getting affected by secondhand smoke. Now, you might wonder, what do these numbers mean? Is this really dangerous or not? I mean, it could be just something that you smell. You're not really too concerned about it. So just keep in mind what these numbers on the side look like. So just keep in mind 40. So this is the air quality index, and this is from the EPA. And so the corresponding particle level, which are the numbers that I showed to you, are these numbers over here in terms of micrograms per cubic meter. And so 40 is basically unhealthy for sensitive groups. So for example, if you were an asthmatic, or let's say that you were somebody who, let's say already had heart problems, you're potentially going to be affected by the secondhand smoke that you're getting at those levels that are above 40. And you can see here, if you're walking outside, Unit 205, you'd be affected by that. In your bedroom, there are going to be times when you're actually affected by those unhealthy levels as well. Now, in terms of the secondhand smoke exposure and what happens, you can see that the levels vary. And again, same scale in terms of 40 being sort of that number where it's unhealthy for sensitive groups. You can see that at night the levels really go down when people are not smoking, but they go back up when people are back in those buildings doing their activities and smoking around. So we know that when we look at this kind of basic science level in terms of exposure assessment, which a lot of people do here also at UCLA, it can actually be a serious problem. Now, again, I also mentioned that you can have smoke drifting from the outside. And so this is another unit where there's a smoker below, the living room is up above. That little blue bar is, or little blue box is where the monitor was placed, and this is how the wind flows around those particular units. So again, in terms of that same scale, when the smoke is present, you can see that there are all these blips that, again, go over that 40 mark, at various times during the week that they measure things. Now, when the smoker was not present, you can see that there's basically nothing going on there. Yes?
Can you tell me what the particulates are that you're measuring in the area?
So they're measuring a lot of different particulates, and I'm happy to send you all that information. So I think that there are a couple of different ways that we actually do the assessment measurements. Some of these are just nicotine alone, and that's actually work that's done up at UC Berkeley. But these are just looking at small particulates. They're just really just measuring those particulates that meet that certain size. So in terms of California and smoke-free multi-unit housing, actually, about 55 communities to date have some type of regulation regarding smoke-free multi-unit housing. And 6 communities actually have laws that are essentially going to get them to 100% smoke-free multi-unit housing within a few years. And the largest probably being Pasadena, which just passed a law last year and I think is expected to make all of their multi-unit housing smoke-free, I think, next year. You can see that a couple of counties have also done this in their unincorporated areas. We also know that when you ask people who rent, they actually tend to prefer not being exposed to secondhand smoke. So you see 40% prefer living in a completely smoke-free building. Another 40% prefer living in buildings with separate smoke or no smoke areas, although that doesn't necessarily work too well when you think about how smoke can potentially drift. And there's a researcher up at San Francisco that tends to like to use the analogy of a swimming pool and what kids do in swimming pools and how you really can't stop the flow. The other thing is that, again, it's a movement that that's picking up steam. Senator Padilla, who's down here in Southern California, actually passed a bill that makes explicit that landlords can implement smoke-free policies starting basically January. So again, I think that there's more movement towards this. But in terms of why somebody, let's say like if you were an owner or a manager of a multi-unit housing building, why would you want to, make your place smoke-free? So there are some positive factors. We all knew that there probably is some type of damage reduction, whether it's from smoke damage or from fire risks from insurance, and that, as you saw, there's a demand for clean air. On the other hand, if you're that owner or manager, you don't want to have to enforce this. You don't want to get between two of your renters to, try to mediate some type of discussion about this. On the other hand, renters, there are some positive factors. Most renters are non-smokers. Even though more smokers do rent, the majority of people who rent don't smoke. And there's also a health improvement. You're going to have more clean air around. Of course, there are some negative factors. There have been concerns about rent control. This is the reason why Santa Monica has not passed any stronger regulations to date, although they do have regulations about secondhand smoke in multi-unit housing. And there also are privacy concerns. Again, what are you doing in your own home? Although again, if those surveys that talk about having smoke-free policies, about half of smokers have smoke-free policies in their homes. So you know that most smokers actually don't even smoke in their homes as well. In terms of just thinking through all these reasons why these type of regulations might or might not be implemented, there actually is very little data on preventive smoking-related costs to owners or managers from having smoke-free policies. And basically, this is all anecdotal. You'd interview some owner or manager, they tell you it's like $500 that they saved, or it was $8,000 in terms of damage. That happened. And surveys that had been done previously for multi-unit housing owners or managers basically didn't ask this type of information about smoking-related costs. And they tended to focus on really large complexes. And if any of you are owners or managers of apartments, for the most part, these are sort of mom-and-pop operations. So you might actually sort of own a fourplex and you might manage that. It's not usually these huge ones that have 20 to 100 units or things like that. And now, the other thing is that if there was more data on smoking-related costs, it might encourage people to potentially support smoke-free multi-unit housing. But at the end of the day, nobody really knows one way or the other how, before we did the study, how big or small this problem really was. So the study goals that we had was to, number one, estimate the smoking-related costs borne by multi-unit housing property owners. Two, to estimate the prevented smoking-related costs in multi-unit housing properties due to smoke-free policies. And finally, to predict what economic benefits would be generated by making all California multi-unit housing properties completely smoke-free. So we worked with the California Apartment Association, as I mentioned earlier, and they're the largest statewide trade association for owners and managers of rental property. They have over 17,000 members, and they cover approximately 800,000 homes. Now, it doesn't cover everybody. So particularly down here in Southern California, there's a different apartment association of California Southern Cities and of Greater Los Angeles. So there are a couple of that we didn't really necessarily work with. But for the majority of the state, this is the group that has the most coverage. Of the 12,793 California Apartment Association members, we basically decided that we would talk to those people who actually owned or managed multi-unit housing, so it just had to be more than one unit. You can be a member of this association if you're just managing or owning one unit alone. If they didn't have a telephone number, we didn't contact them. And we selected them randomly based on the different chapters that are in California, and we proportionally sampled them to get to actually find out what was going on with those people that run very large multi-unit housing complexes, as well as those who run very small multi-unit housing complexes. So our final sample was 343 multi-unit housing owners or managers. When we think about response rates for science, we usually like to hear 70% response rates. Our overall response rate was 22.4%. Now, first of all, we actually had to contact these people. So in terms of if we actually got a hold of them, the cooperation rate was around 40%. So as I think I mentioned a little bit later in the limitations, this is actually not that far off from their own internal survey work. So part of the reason why it's been so difficult to do this kind of work is that nobody sells these lists. So if you talk to any of these apartment associations, they will not give, there's actually explicit as in your membership agreement that they are not going to give your name away to other marketers or things like that. So in order to have access to contacting this group, we needed to make sure that this was something that was in the best interest of the California Apartment Association and its memberships. And because they've been very interested in this issue for quite some time, they really wanted to know. So we did some work with the Public Research Institute, as I mentioned, using computer-assisted telephone interviews, and we conducted it between July 2008 and February 2009, and we actually had the survey suspended, and I'll talk a little bit more about that, between August 2008 to November 2008 due to the spending freeze during one of our many California state budget crises. And so basically all people, if they answered that they wanted to do our survey, they were asked to identify the property they either owned or managed with the most recently vacated unit. And so again, as I mentioned, most owners and managers actually have more than one property, so it's a little hard to figure out which property should they answer questions about. And we wanted to have them focus on the most recently vacated unit so that they would actually remember something about that. If you have 5 properties, you're not necessarily going to remember exactly what's going on in every single one, but if it was one that you actually had to focus on more recently, you're more likely to know. So we asked people to estimate the costs incurred over the past year due to smoking-related damages on the entire property with the most recently vacated unit. And we went through every single one of these categories. This is a very long survey, as you can imagine. We basically asked them what were their cleaning costs, what were the repairs and maintenance costs, all the way down the line. And we asked them, first of all, was there any work done in that past year? What was the overall cost in that past year? Was any of the smoking related? Would you have done it anyways? Because if you're going to do it anyways, that doesn't really count as a true cost. Was there a smoking-related cost? How much of this would you say was due to smoking-related costs? And did you withhold any amount of security deposit? Because again, you could certainly make up that difference if you if you were the owner or manager and withheld some of that security deposit. And how much did they actually withhold if they did so? So this was pretty extensive, but we actually sent out pre-notification letters to all the people who we randomly selected as potential survey respondents to let them know that we were going to ask them this set of questions so that they would be prepared. We also asked all respondents if their property was completely smoke-free, and we defined that as being as a place that had no smoking anywhere on the property, whether in private units or in public places. And those who reported no were then asked if any of these on the property were smoke-free, whether it was the buildings themselves, public places, specific units. And if they said yes to any of this, we said that they had a partial smoke-free policy. And then if they answered no to all 4 questions, we said that they didn't have a smoke-free policy at all. So in terms of the proportion of respondents that said that they experienced smoking-related costs in the past year, more than a quarter said that they experienced them. And so in terms of the people who said that they had complete smoke-free policies, about a third of the respondents said that they already had one in place. And again, here you can see that about 20% or a fifth of them also said that they had some smoke-free policy. So if you're thinking about in terms of California, again, this is proportionally weighted so that would be reflective now of the entire California experience. More than half of the properties a little bit over than half of the properties in California have some type of smoke-free policy implemented in their properties. So when we break this out by small and large owners, there's a big difference. So you can see that the people who are experiencing the smoking-related costs are really those people who are responding about their large complexes. So you can see that nearly half of those owners reported some type of smoking-related cost. And when we look at the small owner experience, 16%. It's a lot lower. When we look at how many people actually have complete smoke-free policies, nearly half of the small owners reported having some type of having a complete smoke-free policy, in comparison to those large owners who really don't have those policies at all. And then you can combine that with the some smoke-free policy to see how big that actually is. You can see that, again, most of the large owners have some type of policy. Most of the time it's actually in public places, not really in the whole buildings, but they have some partial ones. So in terms of those actual costs, so the top line here just tells you that overall experience. About a little more than a quarter of those of all respondents reported that they had some type of smoking-related cost occurring. The mean cost for that in the past year was around $5,000, but it can range quite tremendously. It could be anywhere as low as $50 all the way up to $84,000 in the past year. That's a pretty sizable amount. And when we look at those places that have complete smoke-free policies, they still report having some smoking-related damages and costs. So it's a lot less than the other groups, so it's at 16%, and the total amounts are also lower as well. So it's less than $2,000. You can see the range here is also a lot less as well, $100 to $8,500. For those places that have partial policies, more of them reported having smoking-related costs, about 40% of them. And you can see that this is really where that $84,000 one shows up. It's actually in here. But overall, the mean and the median were both high, almost $10,000 as a mean, $3,400 as a median. And then those places that didn't have any policy, about 30% of them reported that they had some smoking-related costs. And again, the amount is more than those places that had complete smoke-free policies, but again, still less than those places with partial policies. In terms of what category of costs, again, you saw that huge breakout in terms of all those different questions we asked. For the most part, these all come down to cleaning costs, painting or decorating costs, or repairs or maintenance things. Very sundry type of things, but they add up. Now, these are, so we did more statistical analyses to try to determine which sort of things would predict the occurrence of smoking-related costs as well as the amount of smoking-related costs. So when we broke out those numbers that I showed you earlier, when we compare those places that have a complete smoke-free policy, when they're compared to either the places that have partial policies or those places that have no policy whatsoever, the odds ratio of having an occurrence of smoking-related costs is essentially half. So what these numbers basically mean is that compared to those, if you have a complete smoke-free policy, the likelihood of you having any type of smoking-related costs at all is half that than the other type of properties. So there's actually a big benefit in terms of having a complete smoke-free policy. If you had an on-site manager or owner, you essentially almost doubled the odds of having smoking-related costs. And you might wonder, well, isn't there somebody on-site managing this? Shouldn't you have reduced the costs from occurring? We think that this is really just a proxy for the size of the building, because there are actually laws that say that if you have 16 or more units, you must have an on-site manager or owner. So these are essentially a measure of the larger properties having occurrences of smoke-free, smoking-related costs, independent of having smoke-free policies. The second thing is that we looked at the amount of costs, and those factors in terms of having a smoke-free policy didn't actually make a difference, so I don't list them here. And once you actually have an occurrence, you're going to have a cost, and it might not necessarily mitigate the amount of costs. However, the two factors that really made a difference in terms of how much those costs were the total number of units that you have. Of course, if you have more units, you're going to expect that you're going to have more costs. And then shared ventilation, so that there's actually ways for the smoke to get through into your other units. So I'm not going to necessarily go through everything here in terms of our calculations, in terms of what happens if we made all multi-unit housing in California smoke-free. I think that the main thing to take away from this is that even if you were going to make all places smoke-free, you're not necessarily going to completely eliminate the cost. So when we make those type of calculations, we actually take that into account, that you're going to mitigate some of those costs, but there still will be some residual costs that happen anyways. Now, of course, if all costs disappeared, you'd save probably $38 million in terms of smoking-related costs. But because there's still going to be damages going on, the averted or the smoking-related costs that you're going to be able to take away from implementing these type of policies, if there was a statewide policy, it's around $18 million. So in the big scheme of things, not a lot, but if you're that individual owner, it makes a difference to you. So as I mentioned, there were some limitations. The response rate wasn't that great, but we know that these response rates are very similar to the internal survey response rates that are done by the California Apartment Association. Of course, there are always going to be some potential effects from the budget freeze, although the findings were very similar before and after the survey suspension. And then the other thing you might say, well, these are all sort of self-reported costs. Well, I mean, if I were asked to survey off the street, am I going to know these type of costs? Probably not. However, because we told people ahead of time what to expect when you get a call from our survey team, we think that there's a higher likelihood that they were reporting actual costs. And when we did some cross-checks in terms of looking at different ways of measuring the costs, it seems like these are relatively accurate information. And again, focusing on the most recently vacated unit might have minimized some of that recall bias. So that's sort of the science part here. I don't think I need to necessarily go through the conclusions, but basically, we know that if you have a completely smoke-free policy, you're going to cut the likelihood of you having costs in half. And places that have partially smoke-free policies have high costs and high amounts of smoking-related costs. But the problem, of course, is that this is just a slice in time. If we were tracking them over time, we might have a better sense of what's going on. People might have these partial policies because they already were experiencing problems and they're trying to mitigate them. So they're trying to implement them on the fly, and we just happen to catch them at a certain point in time. The final thing is that making a multi-unit housing property completely smoke-free may result in significant savings for the owner. So let me just skip through this and get to the perfect storm part, because this is more interesting. So I don't know how many people are old enough to remember these sort of choose your own adventure books, but this is what it sort of felt like. So I actually got involved with this project more as a favor to the California Tobacco Control Program. There are not very many people who do the economics of tobacco control, let alone secondhand smoke. And so all those 740 forms that we all have to fill out, whenever I do anything related to tobacco control in California, I always have to mark yes, because I'm the oversight chair, that I might have a potential conflict of interest. I don't get any money for this, but there's a potential relationship. So anyways, I had no plans on doing this kind of work, but the only other economist in the country who does this kind of work basically said no, that he was not interested in doing this. So they asked me, because this has been a major focus for the California Tobacco Control Program, would I help them out? So I said, sure, I'm a good guy, I'm happy to help. So, as you can see here, this is scene one, the bait and switch. So I was recontacted by the Department of Public Health, because I actually told them no the first time, to develop a project to determine if there are financial benefits for multi-unit housing owners for making their property smoke-free. This is a priority question for them. There was no literature in this area. When you turned them down before, you suggested other researchers. They didn't work out, and they're coming back to you. You work with the UCLA Survey Research Group to develop a proposal for them. After you send them the proposal, they like it, but they say the cost is too high. They always say that. The state suggests working with a less expensive survey research group than the internal group that we had here at UCLA at the time. Before getting to the last point, they actually tried this 3 times. And each time I talked to very reputable survey groups that do a lot of great survey work in California as well as nationally, finally, the 3rd time, they found a group that comes in at 50% less than the cost of the UCLA Survey Research Group. All the other groups are all around the same price, because that's really the going rate for doing this kind of work. So you talk with the UC San Francisco General Internal Medicine group that has worked with them before. Actually, it was my sister. So I really didn't have a lot to say. They tell you that they've been pleased working with this group. They had great outcomes, it worked really well, and they're 50% less, right? So, do you accept the contract with the lower cost working group? Do you stick with the original team and give them an all or nothing option, or do you do something else? So who would do option number 1? Accept the contract with the lower cost working group. Any hands?
Do you trust your sister?
Well, as a point of disclosure, my sister and I were actually the 2 external candidates for my current job. I'll just leave it at that. So it sounds like most people are actually not that interested, or at least I don't see that many hands going up for accepting the contract with the lower cost working group. Do you stick with the original team and give them basically an ultimatum? We're doing this one way or the other, or we're going to walk away. Any hands? Okay, some more experienced people. Any other options that people want to suggest? Yes?
The reason I asked the question I did earlier is because I think that your proposal is fraught with holes. For one, you don't mention anything about people who smoke drugs, okay?
That people who smoke what?
Smoke drugs. I consider marijuana to be just as bad as smoking a cigarette, and yet that's not covered. And it's very annoying to me, especially the stuff we have now for medicinal purposes is super strong, and I end up going to a humongous coughing thing when that happens, okay? And I think it transports just as many particulates. Number 2, it doesn't cover idiots who live below people, who barbecue all the time on their patio, and then when they do, their smoke and soot goes up on the patio above and into that person's house if they have their windows all open. And I know just how bad it can be because I lived over one of those idiots, okay? And talk about particulates, it's pretty bad. And 3, the big thing that you don't mention here is that the real reason that this is being done is because the tobacco industry is known for impregnating their tobacco with all kinds of chemicals, which is really what the bad thing is, not the smoke itself. Okay, there have been people who are over 100 that have been smoking their whole lives, and they still don't have cancer. Okay, they still don't have lung problems. The reason they don't is because they don't smoke tobacco that's been washed in drugs and chemicals. Okay, it's pure tobacco.
So let me take your 3 points, and I'm happy to answer them if I forget them. So in terms of the last one, I agree. When you look at the chemicals that are actually in cigarettes, there's a lot of arsenic, there's a lot of carcinogens that are actually in there. So that does pose a significant problem. So when we look at the particulates, it's really just more of a proxy measure for all the badness that's actually coming along with it. So I think that in terms of what happens to people who are longtime smokers, I think that I would say that they're the survivors because we know that there are a lot of other people who have died early in terms of either dying from cardiovascular disease or from cancer. In terms of looking at the actual causes of death for people who die from tobacco-related illnesses, cardiovascular disease is equal to cancer. So it's right up there neck and neck. And when we look at the United States, it is the #1 preventable cause of death, more than obesity, more than more than, for example, alcoholism. So in terms of making a difference, this is probably one thing that we really should be focusing on is ways to control the use of tobacco. I think that with regards to the other types of particulates, I agree, they are problems. And I think that on one hand, that's the reason why in our survey, we specifically asked them, are they due to cigarette smoking related costs? Because we know that there are other costs as well that can happen. Now, survey methodology is only as good as the people answering the questions and as good as the information that you get from them. So it really does, it's not going to be ideal, but it certainly points people in the right directions to do the actual causal work, to do the actual measurements to finally see what is the flow like, what are the particulates like. So that's the reason why we actually need a more comprehensive approach. That's the reason why we have CTSI, so that we actually have T1 and T2 type of science working together. The third thing is marijuana. It's very difficult to do work on something that is technically illegal. Even though we know that there's a lot of marijuana use, particularly here in California. On one hand, it's not really well known what's actually in the pot that people smoke. So in terms of if they're doing the same kind of washing, nobody knows, right? I mean, it's just not regulated. At least with tobacco, you sort of know what's in there because we have forced them through lawsuits to actually disclose more of their information. But because marijuana is not a regulated economy, it's really unclear what sort of effects should we expect from it. And it's a question that comes up all the time. So anyways, let me just go ahead and move on with these different scenarios in terms of what I ended up doing. So I ended up agreeing to work with the other survey group. We worked out a deal to sort of split the difference. We retained one of the UCLA survey group staffers for oversight, and the state agreed to basically backfill our budget in case there were any delivery failures from the subcontracted survey group, because they're coming at 50% less. I mean, that's just incredible. Either they've got some secret sauce that is way better that we should really learn about, or something's really wrong. So, scene 2, suspension of belief. So the survey group director unexpectedly retired. Yeah, he's a very well-known survey researcher. So, I mean, it certainly seemed very credible at the time. He just retired a couple months after we started our project. The associate director, who is overseeing your project because the project director is relatively new, takes on interim duties. So he's doing double coverage. He's sort of helping out the project director. He's doing all the regular director activities as well. Then, unfortunately, the project director's dad had a massive stroke. It was really sad. And so she, of course, she took time off during his hospitalization and after his discharge and then after he passed away as well. And so the associate director took over even more duties at that point, sort of trying to run the operation. So then problems started happening. So, I don't know how many people work with the UCLA IRB. I think that our IRB has improved dramatically since I joined the faculty. So, but this was pretty early on when I was here. Everybody always thinks that their IRB is the slowest IRB. Well, I found one that was worse than ours. So this one took 6 more weeks beyond our lengthy approval process. And so given that we were sort of off track, we estimated a certain amount of time. It took a lot longer than anticipated here. It took even longer at the survey group. We needed to request a contract extension to basically renegotiate the contract. The second thing is that when you outsource, you usually think that there are certain policies and procedures that are put in place to make the survey operations work correctly. And so we went up to just monitor to make sure everything was working out fine. We went to the interviewer training, and we found that the survey instrument didn't work. We were just thinking, wait a minute, we just gave you guys a set amount of money, and this program doesn't work. We're seeing bugs here. Didn't you debug the program? We went through the second round of being very careful and meticulous about making sure that there were no problems with their software, doing a lot of oversight, and so we started the survey. But even once we started the survey, we did data checks and we still found more problems. This is not what you want, particularly as somebody who does not do a lot of survey research. In order to do the extension, you need their spending numbers. They can't give you any numbers. They keep telling you, we're working on it. We're waiting to get it from this particular office. A couple weeks go by, where are the numbers? We're still waiting. And so this went on for several months. Then the governor suspended all state projects while our survey was in field. Now again, we're not the only survey or public health survey that got suspended doing this. But basically because there was no state budget, anything that was considered non-essential had to be stopped. So after the suspension got lifted, our contract technically expired during the suspension. So the state still wanted to see this work done. And they promised to extend the contract and add funds to make up for all the problems that we had because basically we took the group that they wanted us to work with and it really didn't work out so well. They acknowledged the problems with the subcontractors and give us the option to switch. Basically they acknowledge that they really made an error and that they're willing to sort of make amends. However, unfortunately, the group that we worked with here at UCLA, which had been in existence here at UCLA for quite some time, unfortunately, the director passed away during the interim. So we didn't really have that option to work with our in-house group anymore. So do you stick with the current group despite the problems? This is sort of the same issue that, do you kind of take it as a sunk cost and keep on moving? Or do you start over with a new survey group? But you don't really have a survey group to necessarily work with. You have to renegotiate a whole new contract with outside groups because you don't really have an internal group. You could try to find out, during this time they were actually in the process of trying to decide would they hire a new survey group director, what would they do with the group, or do you try to work with another group. So option number one, stick with the bad horse. Anybody? Okay, start over with a new group. Would you kind of try to stick it out with the UCLA to see what happens at UCLA? Okay, number of hands go up. Do you go back to one of the other groups that you talked to and turned down? Okay. So we opted to stick with the current survey group. We did ask that the project director be replaced. We just didn't think it was a good situation for her. She's trying to do work, but it's not really working out. She's got her mind on other things. And so we actually did talk about trying to work with the UCLA group, but the timing just was not going to work out. And actually, that group ended up folding because we were not able to find a new survey director that would have worked out, which is unfortunate because it just means that we've lost that capacity here at UCLA. So, scene 3. I think people remember this if you've been around UCLA long enough. The gift card is not in the mail. So we restarted the survey. And your partner organizations tell you members have complained that they never got a gift card. So this is the California Apartment Association calling me saying, hey, that survey you were doing? Somebody said they didn't get their $25 gift card. What happened? Turns out the survey group never sent out gift cards as planned, as far back as when the survey started. And technically, they don't have a contract either to do anything now because the extension is still pending. So what are you supposed to do? You work in an agreement to send out gift card respondents to the old respondents, the people before the survey got suspended, and get paid by the state. The state actually agreed to all of this. But then you find out that UCLA is in the process of reviewing their gift card policy. Now, I'm not sure what sort of crazy stories people heard during this time frame or if people remember this. We had some of our research fellows photocopying dollar bills because they needed the serial numbers. It was not a good time in terms of doing this kind of work. So you get approval from the department, as I mentioned, to send out gift cards to respondents. But 2 weeks go by before purchasing sends you some questions. And then it's been another couple of weeks. And you still don't hear anything. And then you start getting some more angry calls from the California Apartment Association. Subcontractor gets approval to send out the gift card incentives, but all of it's at risk because technically their contract amendment is still stuck at the state due to legal issues. And I don't know how many people have ever worked with a state of California contract. I know Connie has. I think Connie remembers this one. But that's a sizable amount of money that we're talking about. It was probably close to $10,000. I would say maybe 5% of the overall contract that we had with the state of California. I mean, who's going to, are you going to shell out $10,000 out of pocket to do this? It's kind of questionable. So, do you force the subcontractor to send out the gift cards? Should they send out all the gift cards as planned? And should you give them all the work and tell them to do the old cards and the new cards? And tell them, you got to take on some of the risk? Do you wait until UCLA resolves its gift card policy and send it out yourself, given your lack of confidence in the subcontractor after the last couple of things? But that's likely going to lead to further delays, and this is going to sour your relationship with either potential survey respondents, because people hear, people will talk all the time, and if other people know that there's a survey going around, they're asking apartment association members. It's a really long survey. You saw how long it was in terms of the questions we asked, and that wasn't even all the questions. That was just the main question. If people are already sort of down on that experience, it's going to be long, and you're not going to get anything out of it. Why would anybody want to do this? And not only would we have problems with the respondents, we're also going to have problems with the California Apartment Association. We often talk a lot about community partnered research about building relationships. And there are many stories out in the community about organizations that have worked once with an academic organization and will never do it again. And so we definitely don't want to try to perpetuate that. We really want to work closely in partnership with other organizations. And we never want to leave a bad taste in people's mouths in terms of working, for example, not just with UCLA, but any organization. So work with the subcontractor, force them to do stuff. Okay, no hands. Wait until UCLA works out the gift card policy. Anybody remember how long it took to work out that gift card policy? I don't know if Lenny was actually on that committee. I'm sure somebody in here must have been on that committee, because I know it took a while. We took back funds from the subcontract, and we actually did the gift disbursement on good faith that the contract would be reinstituted, and it was. And ultimately, I have to say, if the tracking costs that we were required to do because of the gift card policy, because technically this is money, and we want to make sure that we're appropriately giving money rather than, for example, just pocketing it. That being said, the tracking costs were nearly as much as the gift card value. I'm not sure that I would ever do this again. And part of the issue is that we often talk about using, let's say, certified mail. That should be good enough, right? We actually did certified mail with those little green card return receipts. 50 cards were lost at the federal building, at their post office. And we can't recoup those. It's just lost. What are we supposed to do? Yes, technically lost. So we ended up FedExing the remainder of all the gift cards. It's $20 a pop. These are $25 gift cards. This doesn't make any sense. That being said, we're happy to follow regulations to make sure that everything works out. And the good thing is that there really was no difference in response rates before or after the gift card incident. So I think in terms of in terms of the overall experience that I had doing this project, smoke-free multi-unit housing, it's a growing trend. And I think that if you own multi-unit housing, the costs do matter. And if you live in multi-unit housing and you are exposed, you should let your owner or manager know. I think that increasingly people are aware that it's a problem, but this really comes down to it's saying that it's not okay. Is it a social norm to allow yourself to be exposed to secondhand smoke? You can say no. I think that it's not easy to work out how that should follow afterwards. But that being said, there's actually a lot of support out there in terms of trying to help people work through these issues. In terms of running projects, a lot happens behind the scenes, and some of it filters up in terms of managing projects, but some of the stuff happens behind closed doors, so it's always good to at least let people know some of the stuff that goes on, because that's never going to make it into a journal paper or any other sort of scientific discussion. I really think that perseverance is critical in terms of getting projects done. It's not a sprint, it's a marathon, and you just have to keep plugging away. And I think that despite the occasional pain, the results are often worth it. And I think that in this particular case, I think that it was helpful for the field in terms of hearing what those costs actually were. I hear from people out in the field all the time saying, we cite your work all the time. We've been using these numbers to help explain to people what these potential costs are, why it would be potentially a good thing for you in your community to implement. And for some of those communities that I just mentioned, some of this work was discussed in the hearings that happened at their city councils and so on. So anyway, so that's all I really wanted to sort of present to you in terms of some of the background for the work that we did, what we found, and some of the pain that went into it. And happy to answer any questions that you guys might have. So Thanks for having me.